My name is Tracey Hanson, and I'm the CEO and founder of the Josh Hanson Trust. The trust was established after my son was killed in an unprovoked attack. The flawed investigation and our need to campaign for 4 years to get justice compounded mine and my family's trauma. Our charity aims to ensure that no other family goes through what we experienced. We campaign for victims' rights and deliver crime prevention interventions to the police and into children in schools, and provide trauma recovery support services. I saw the opportunity to become a patient safety partner, and I was keen to be involved because as a bereaved mum and suffering from post-traumatic stress disorder and not receiving the right care, not feeling listened to, and when my trauma was acknowledged, not having the access to the appropriate and adequate services, I felt I had something to offer to the role. I've been a patient safety partner for a year, so I'm new to the role. But in that role, I've hit the ground running. Central North West London NHS Trust have been absolutely amazing in bringing me on board as part of their team. And we are working very closely in all things patient safety partner. Part of my role that I find the most fulfilling is working alongside the safety team, a safety team that are really well established within Central North West London NHS Trust, and being asked for contribution really to strategy and development. And as part of that, what I find really fulfilling is being able to offer my lived experience and those of the clients that I support or beneficiaries, to sort of make sure that terminology is adapted so that it serves the patient and carer well, so that they understand things in layman's terms, that they're asked about their experience, that they are allowed to contribute to patient safety investigations, and to also be acknowledged, really, because quite often patients and carers where something's gone wrong feel very isolated. So being able to speak on their behalf and listen to what they say, and and being able to bring that forward as part of a patient safety partner to the patient safety team is a real honour, actually. As part of the charity, we work with those that have been victims of crime, and their journey often brings with it to us not only navigating the criminal justice system, but also navigating national health services, and who to go to, who to talk to, what to say to a GP or a professional, because bereaved families, especially around traumatic incidences, it's very hard to understand what to offer individuals like us, and it's very complex. But most importantly, being able to sit down with patients and their carers, and sometimes, and well, actually quite often, the bereaved family member finds it very difficult, especially when they're in the early stages of their grieving and they're in profound shock. Their nominated person or named contact will often represent them. So for me to be able to sort of support them by listening to what they're presenting to me, and the difficulties and the hurdles that they are coming across, means that I can feed in straight away to the team directly, not just my lived experience or case studies, but actually working closely with bereaved families. Patient safety challenges that I see at the moment would be the lack of open communication, which takes into account the communication needs of patients, carers, and staff. We've also got this awful knock-on effect of COVID-19, and there's a huge backlog. While we're no longer isolating and things are making positive inroads into everyone connecting again, we've seen that the waiting lists haven't been reduced. There's a lack of staff. Hearing from patients who feel that they've not been heard or have not received information about follow-up appointments, that's proving to be really challenging for them. The next couple of years, I think, are going to be quite challenging, if I'm honest, because there's going to be this transition of change in culture with PSERF. All staff across the whole of National Health Service will need to be fully informed about what PSERF actually means to patients and carers, and moving away from the serious incident framework. We're now going to be looking at a different culture. So a culture not one of blame, but one of what went wrong, how can we avoid that from happening again, and how can we show that we have heard and we are making these changes, and for patients and carers to be part of that journey. I think it's really, really exciting to think that patient safety partners can drive forward the change in PSERF, as part of this changing culture, because they can amplify the voice of patients and carers. I just think that the work that staff at Central and North West London NHS Trust are doing is absolutely phenomenal. They really do listen to patients and carers' voice. Experts by experience have a say on their panels. They have focus groups, which we're part of. They really have got this passion about bringing about change. And I do think that having the patient voice and carer voice brought forward in a lot of the development, and being seen and being heard and hearing sorry, which they are very much about promoting, is a breath of fresh air. I mean, it fills me with so much hope, and it's a wonderful opportunity for me to feed back to the very people that I support, who quite often don't feel that they're being heard. So if we're moving forward with PSERF with that in mind, everybody is going to have a much better experience, including the staff, medical professionals. So I'm really hopeful. And again, I will say I'm humbled that I am part of this journey. So if I had a magic wand, I would help develop a healthcare passport that is routinely updated with every interaction and health professional that a patient has ever had access to, who's been treated by, and for the health professional to be aware of the patient's history. This would prevent the patient from being re-traumatized, experience compounded trauma by having to repeat their personal issues every time, having to relive what they need, what support they may or may not have received as yet, and any changes to their current circumstances. We shouldn't have to really fight to get access to our own medical records, which would also encourage a patient to take control of their health condition, also enabling partnerships between the patient and the NHS, a more open, transparent and compassionate conversation would help patients, especially when they have autonomy around their professional records and history. Things that I do outside of my role as a patient safety partner, which make me think differently about patient safety, is the need for partnership working and joined up approaches. I am a member of the Victim Reference Group for the Victims Commissioner. I'm a vice chair of the Brent Police Independent Advisory Group and also patient safety partner. And the three things, they really sort of highlight the importance of having access to information, of being able to understand processes and procedures. And I do think that having an open line of communication, one where both patients and service providers work well together, is really, really important. You know, it's not them and us, it's not patients and carers and staff, you know, it's everyone, because anyone can be a victim of serious violent crime or bereaved or you know, in pain or in need at any time, and that goes for every human being. So the human factor approach is really, really important. It's around compassion, understanding, listening, duty of candor, you know, be heard, be seen. I'm going to be quite cheeky because it's more than one, but it's all the same. So I have always been kind of the least likely to go out there and take on a physical challenge. And that's not because of any physical inability, or certainly not in the past, but more about lacking confidence. But within a 6-month period, I started the Couch to 5K for my mental health and well-being. I then ran a 5K, a 10K, a half marathon, and the London Marathon, finishing all of them. And I've got all the medals that go with that. And then after my son's death, to raise awareness and to establish our charity, I jumped out of a plane and have climbed 2 mountains, Old Man Coniston and Snowdon.